As a child, I've always been interested in becoming a pharmacist. Drugs and how they work in our bodies has always been fascinating to me. And there is a lot that they can do, whether it is helpful or detrimental in terms of drugs. In addition, there is a lot more to the job than dispensing prescription drugs due to the complex applications of chemistry. So for most people, pharmacists are defined as licensed professionals who dispense prescription drugs and provide information regarding a patient's well-being. In order to become a qualified pharmacist, the required amount of education and training must be taken into consideration. Before entering the PharmD program, applicants must take post-secondary courses such as chemistry, biology, etc. And after that, they must pass the Pharmacy College Admissions Test, or PCAT, which is a specialized test that determines and identifying qualifying pharmacy students. This program requires students to take courses in chemistry, pharmacology, and medical ethics, usually taking an average of 4 years to complete, though there are some programs that offer 3-year options. Moreover, pharmacy students must pass 2 exams to get their license, NAPLEX and MPJE. The North American Pharmacist Licensure Exam, NAPLEX, tests pharmacy skills and knowledge, while the Multi-State Pharmacy Jurisprudence Exam is a required state-specific test on pharmacy law. When students graduate from a PharmD program, they may need to complete 1 to 2 years of residency or receive additional training for a specialty like internal medicine. And varying by state, they must also complete a number of hours as an intern and can earn a certification that shows their advanced level of knowledge. On average, pharmacists make an annual salary of $122,230. However, many can make $87,120, which is the average starting income, or $157,950, which is usually due to years of experience. In addition, they have many duties that need to be fulfilled. They fill prescriptions, verify instructions from physicians on proper dosages of medications without harming the patients, and they educate patients on how and when to take a prescribed medicine, informing them on potential side effects from taking the medicine. By doing this, more people can learn the consequences of improper drug use, and millions of lives can be saved. Lastly, other responsibilities they have are conducting flu shots and vaccinations, as well as completing insurance forms that ensure that patients get the medicines that are necessary for them. Pharmacists with higher ranks can oversee the work of pharmacy technicians and interns in order to prevent major mishaps that could lead to someone's hospitalization or death. Though they have many responsibilities, there are many benefits that come with becoming a pharmacist, such as a high salary and good health care program. Since most pharmacists make a significant amount of money, this gives them an advantage to pay off student loans from medical school. For example, instead of paying off debts within 20 years, they can pay it off within 15 years, which means that pharmacists can spend more money on things that they want to do. Furthermore, pharmacists are commonly given the options of 2 medical plans, though there are also other beneficial plans: AHSA and Flexible Choice PPO. A HSA plan is when participants select a primary care physician and stay within the network for all health care services, which allows participants to save on future prospects, while Flexible Choice PPO offers 3 health care provider options within 1 health plan, so there are advantages of choice, flexibility, and access to care. They are also provided with the basic life and accident AD&D insurance at no cost to participants. The life benefit is 2 times annual salary with a maximum benefit of $300,000. Lastly, the career offers flexible hours due to many pharmacies being open for 24 hours. And this is the life of a pharmacist.
When a prescription is written for a drug or treatment, the next step for the patient is usually a visit to the pharmacist.
Be a few minutes, okay? Thank you.
And while for most people that often means going to the local drugstore, hospitals and community clinics have pharmacies as well. Typically, pharmacists spend most of the day standing at a counter, dispensing medication. They may also compound the medication, though this is now a much smaller part of a pharmacist's practice. While many of the drugs they handle are pre-packaged by manufacturers, pharmacists are expected to understand the ingredients and how they might interact with other medications. This is a profession that requires careful attention to detail. Making a mistake and dispensing the wrong medicine could have life-threatening consequences.
Okay, so your prescription's all set. What the doctor wrote is medication to help you sleep.
Part of the job is being able to explain to people how the prescription should be taken or administered, and providing information on drug interactions and side effects.
Just be careful when you wake up in the morning. Sometimes you might feel a little hungover, a little drowsy.
There's also a lot of paperwork involved. To study to become a pharmacist, you must first prove your aptitude in science and math by passing the Pharmacy College admissions test. After earning a Doctor of Pharmacy degree at a college or university, pharmacists then need to be licensed by the state. With additional education, pharmacists can move into administration or teaching. They can even do research to develop new drugs. But the goal is the same. Helping people get the medications they need to get well and stay healthy.
So, most of their days, they're on their feet, so they must be somewhat active. Most can work full-time and have the choice of working night or morning shifts, and they must be able to pay attention without being distracted. And it can be pretty mentally demanding as well. The task can be repetitive, and you must be prepared to answer countless questions people ask regarding the prescription drugs and interact with them to fulfill their needs. Employment of pharmacists is projected to grow 6% from 2016 to 2026, which is average for most occupations. Due to the baby boom generation becoming older and unhealthier, they typically need to use more prescription medicines than the average person. In addition, there's a lot of pharmacist graduates, which leads to more competition for these jobs. However, students who choose to complete a residency program gain additional experience which can improve their job prospects. Employment of pharmacists in places like grocery stores is most likely to decline, which is due to mail order and online pharmacy preference. When it comes to promotion, there are 3 types of promotions. There's entry-level, pharmacist supervisor, and pharmacist owner. Once they finish their PharmD degree, they are licensed to practice pharmaceutical science as an entry-level pharmacist, which means they do the basic responsibilities. And that means they have a lower income than average. After a certain amount of time, they can be promoted as a pharmacist supervisor, and usually must have at least 2 to 3 years of experience, along with knowledge about the types of prescriptions and education about drug use. However, the rate of promotion may vary from pharmacy to pharmacy and be based on the type of work the staff pharmacists are doing. Sometimes, pharmacists are given a share of ownership depending on the locality. However, if a pharmacist supervisor works for a large pharmacy chain such as CVS or Rite Aid, they can be promoted to Director of Pharmaceutical Operations in that region or hospital. And they also have a choice of working for the government or military, which means that they often have to move back and forth. They spend most of their days on their feet too, and also have to work full-time most of the time. However, 1 to 5 people do work part-time. Over 43% of pharmacists work in pharmacies and drugstores, while 25% work in hospitals, state, local, and private, 8% work in general merchandise stores, and 7% work in grocery stores. Big idea. Though there are many setbacks to becoming a pharmacist, such as the staggering amount of debt from medical school, I still want to become a pharmacist. I chose this career because I am interested in helping people become healthier through prescription drugs. It is a more convenient way of saving people and can be intrusive, but is a better alternative than surgeries. I have learned that it takes more than becoming just wanting to be a pharmacist. Things that need to be taken into account are the amount of schooling required, debts, etc. Now that I have a clear idea of what I need in order to become a pharmacist, I am more willing to study more about pharmaceutical science to prepare myself when I enter a university. This project impacted me by making me more aware of what needs to be accounted for. It made me see that I truly want to stay on track to become a pharmacist. Thank you. And that is my works cited.